I'm Warren Hebert. I'm CEO of the HomeCare Association of Louisiana, and we're videoing this afternoon an interview with Kevin Hayes. Kevin's the lobbyist for the HomeCare Association of Louisiana for over a decade now, and we're going to be touching base with Kevin periodically to share information with you related to what's going on at the state capitol in Baton Rouge. There's some significant issues this year that really will make a difference for home care providers. Kevin, thanks so much for joining us.
Of course, glad to be here.
Kevin is an attorney. He's been lobbying in Baton Rouge for how many years now, Kevin?
About 16 now.
And certainly over that time has built lots of relationships and has a lot of expertise lobbying Baton Rouge and getting some things done for clients. Kevin's organization is Hayes Strategic Solutions. Did I get that right, Kevin?
You did, Warren. Thank you for the plug.
Great. Kevin, we're going to just get right to the heart of the matter here. One of the main issues that we're dealing with this year is a potential provider fee or tax. If you would tell us just a brief little bit about that and where we are with legislation to tax providers.
Thank you, Warren. Yeah, the provider fee is something that has been around for quite some time. It's authorized through the federal regulations developed by CMS, and it allows for a broad-based tax, if you will, some call it a fee, on providers up to 6% of the net, which the idea behind it is the states could then use it for a drawdown of the Medicaid match. Obviously, those that do a significant amount of Medicaid work would benefit by such a fee/tax. However, those that providers that don't do a whole lot of Medicaid would be what we would call a big loser in such a fee arrangement. And so it's obviously a hot button topic at the legislature. In the past, the nursing homes and the pharmacists have gone along with the provider fee, obviously being heavy Medicaid, and apparently it's worked well for them. However, this year, the provider fee was first mentioned that I heard in a meeting with the new Secretary, Dr. Gee, and a lot of folks were kind of taken back by how it would work and what exactly the mechanisms would be, especially those provider groups that don't do a whole lot of Medicaid. So, I mean, obviously, when the budget is as bad as Louisiana's is in the current fiscal year and projected for next fiscal year, everyone's trying to look for solutions, but this simply is not a very good solution for providers that don't do a whole lot of Medicaid. There are two bills that are currently filed as it relates to an overall provider fee for all providers, and that's legislation by Representative Bacala and also Representative Robert Johnson. Those bills have not moved, although Representative Bacala's bill is scheduled for later this week in the House Health and Welfare Committee. But they face significant hurdles. One, any new fee would have to pass by 2/3 vote. And the question becomes, even if it got out of committee, would someone on the floor raise the issue of whether it's a tax or a fee? In Louisiana, taxes cannot be voted on during a session during an even number year, so therefore they would be precluded. So it's got some heavy hurdles. I really don't anticipate it getting out of that committee, either one of those bills. There are two other bills. One has been filed, and it's by Representative Bob Hinskins, and it basically reworks the provider fee for nursing homes. And the other one is a bill by that hadn't been introduced yet. Will actually be a resolution on behalf of the Louisiana Hospital Association. They had done a similar resolution prior to Katrina to establish a provider fee on themselves, but then backed off, obviously, with the uncompensated care issues following that devastation. So provider fees are a hot topic this session. Whether they will get any legs and move through the process has yet to be determined, but it's important for Warren, your members to stay vigilant and be ready to respond should we need them to contact their legislators.
So for those of you who are members and home health agencies that are watching this, our legislative committee has at this point decided that it would be best for us to oppose these bills for a provider tax or fee because in the initial information that Secretary Rebecca Gee shared, she indicated that there would be as much as a 6% fee on gross revenue, and that is something that certainly the providers like home health, who are doing a very, very small portion of our business, maybe 5% of revenue or less with Medicaid, certainly wouldn't be a great deal of benefit there. We'll keep you abreast of that. Kevin, another bill has the potential to increase the fee, the annual fee that home health agencies and other healthcare providers pay for their licensing. So share with us a bit about that. Louisiana's licensure fee for home health has been $600 a year since I started in home health back 30 years ago.
And that's exactly the reason for the bill, Warren. Yeah, House Bill 699 by Representative Julie Stokes from Metairie has been filed to raise the fees for the various providers licensed by the Department of Health and Hospitals from $600 to $1,000. The idea being that money from the department that they could bring in could be used for other things, while the money that currently is used for licensing related stuff, surveys and those kind of things could be taken from a different pot of money, and therefore this would be a way to raise revenue. As filed, the bill raises about $1.5 million to the Department of Health and Hospitals. Although it's a significant jump of $400, when you look at how long it's been since it's been raised, I mean, DHH does have a leg to stand on, if you will, but fees are very difficult. This is another one of those fee bills. We talked about it with the provider fees. The licensing fee bill will require a 2/3 vote. And, that's very difficult. We saw that during the special session as it related to taxes that required a 2/3 vote and how it kind of hamstrung the legislature. And I have a feeling this will be the same way. There are a lot of folks, generally the conservative members of the body, that just don't feel like passing along fees on providers is a good way to go, and that DHH should try to do more with less. The buzz around the special session was everyone's going to have to take a little bit of a haircut, and so now we're in a regular session and they're trying to raise their fees by $400. It's a question of, does DHH have the ability to take a little haircut and do more with less? So we'll see how that one goes. That bill was in committee on Wednesday, and the author pulled it back to try to address some concerns and questions, and it may very well be on the agenda later this week. It isn't as of yet, but it could be added.
Kevin, our legislative group that you've participated in all feel that the fact that it has been more than 30 years since this fee was increased, $400 a year would not be a major problem for most providers. The fact that we may need to use our energy and efforts in other areas, the legislative group suggested that we not oppose this, but I guess it'll depend on what some of the other providers are saying, as well as some of the folks in the legislature. Kevin, one of the last things, and there's certainly so many bills, but we're just going to talk about one more, and that's the potential for cost sharing for Medicaid patients. Essentially, having a copay for the poor who are on Medicaid. Tell us a little bit about that and exactly where that would stand.
There are numerous bills, kind of cost containment measures, if you will, associated with Medicaid. These bills are filed, I think all of them are filed by Republican legislators looking for a way to bring additional, not necessarily revenue in, but maybe better said, to lower the cost of the Medicaid program by requiring the users to have a little skin in the game and pay for some of that. It would be hard for me to believe that these bills would get through the process because there's such a stark contrast to the policy that Louisiana has followed for a long, long time as it relates to Medicaid beneficiaries. And secondly, whether Governor John Bel Edwards would allow such bills to ever become law. So I think there, whether it's a copay provision or limiting access, I just don't think there's going to be a big will at the legislature to do that. But when in tough times, there are sometimes tough solutions, and this appears to be something that a lot of legislators want to have the debate. And some of these bills will actually be in committee this week, and we'll obviously be monitoring the bills and at some point, commenting to the membership about how these bills are going and whether they're actually going to move through the process.
And Kevin, our legislative group again made the decision on principle that we're going to oppose any copays. It's something that we have been doing for years related to Medicare, certainly for those who are poor on Medicaid rolls and disabled. Certainly that puts an undue burden on them, and it sets a dangerous precedent, we think, and could negatively impact, most of the experts say it will negatively impact access to care. So Kevin, thanks for hitting on those three bills. We'll talk about others next time and update people on the more important ones. But one other thing I'd like you to comment on is you indicated in our call today with the legislative work group that CMS has indicated Louisiana cut provider reimbursement more than any other state in the country over the past decade or so. If you would speak to that for just a second before we wrap up.
Sure, Warren. Yeah, I mean, that was really a sobering fact. When you start looking at all the mandated costs and so forth that providers are forced to pay. I mean, we've talked about a couple of them, here, licensing fees. We also know for sure that we have background checks on employees. And then when you look at, and this is just a general observation on providers, but in general, if they've been cut more than any other providers throughout the United States, and yet, the cost of doing business keeps going up, eventually, the reality is, can those providers continue to render services that the citizens of Louisiana need? And so when you hear from folks at DHH that, CMS is saying that the providers in Louisiana have been cut more than any other providers in the country, I think it gives us pause. Are we moving in the right direction? Are we, treating the providers throughout the state fairly? And, what is going to be the best policy moving forward to ensure, access to health care for all citizens in Louisiana? So, I think that's, part of the dialogue that the new legislature, obviously they're starting a new term. The new secretary of the department and the new administration are going to have to get a handle on. And moving forward, how are we going to move forward without the devastating cuts that have been a part of the last 8 years for sure, in Louisiana. So obviously the debate's just getting started on some of that, but but it'll certainly dictate some of the legislation and how the health committees, the appropriations and finance committees move forward in trying to balance a budget when traditionally in Louisiana it's balanced on the back of healthcare and higher education.
Yeah, and Kevin, that's one other piece that I've asked on a few occasions is some folks are feeling like it's time for a new constitutional convention to address some of those areas that have been protected, because every time Louisiana's in a bind, it's higher ed and healthcare that ends up being cut because they're the only two areas that are not protected.
That's exactly right. And so they're looking at potential, bringing everybody together for a constitutional convention. They're also looking at statutory dedications and constitutional dedications and ways that could possibly undo it. I mean, the unfortunate thing is the reason that they were all those dedications were tied up is because the people of Louisiana voted, for the most part, certainly on all the constitutions, that really they didn't trust the legislature with their money. And they wanted to go ahead and lock it up and make sure that, government couldn't get to the dollars that were dedicated. But the problem with that and what we're seeing is that when you have tough budget times, there's no spreading of the pain, if you will, and the pain seems to come down constantly on higher education and healthcare, and that's evidenced by by CMS reporting that Louisiana's been cut, more than any other state as far as the providers are concerned.
Kevin, thanks for taking time out of your busy schedule, even on a Friday afternoon late, to help get us updated. We will plan on doing more of this sort of thing for the provider members of the HomeCare Association of Louisiana. I'm Warren Hebert. I'm CEO of HCLA, the HomeCare Association of Louisiana. Thanks for watching the video, and we look forward to interacting with you related to what you think about this new way of communicating with folks. Take care and have a great day.